Good morning, everyone. Today I am going to talk about some Parkinson disease and condition that affects millions of people around the world. Yet it is often misunderstood. Parkinson disease is a progressive neurological disorder that mainly affects movement. It is named after Dr. James Parkinson, who was first to describe about it in 1817. The condition develops gradually and worsens over time, interfering with daily life. While there is no complete cure, yet awareness, early diagnosis, proper treatment can greatly improve quality of life. The exact cause of Parkinson's disease is still unknown. Sometimes it is think about loss of dopamine producing cell in a part of brain called the substantial nigra. Dopamine is chemical messenger that helps control movement. Genetic factor in some cases mutation in certain genes increases the risk. Environmental factor long term exposure to toxins, pesticide or head injuries can also play a role. Age is the biggest risk factor. It usually appears when the age of 60. Men are slightly more affected than women. Men are more affected than women. Parkinson's symptoms. It differs from person to person. Tremors, shaking, usually beginning in the hands or fingers. Bradykinesia, slowness of movement, making everyday tasks difficult. Muscle rigidity, stiffness in the limbs and joints. Postural instability, problems with balance and coordination. Diagnosis. There is no single test for Parkinson's disease diagnosis. Doctor diagnoses it based on medical history, symptoms, neurological examination, sometimes brain scans used to rule out certain conditions. People may experience non-motor symptoms such as depression, sleep problem, memory issue or change in speech. Treatment. It cannot be cured. Treatment helps to manage symptoms. Medication. Sometimes medication for it is given to increase or substitute dopamine in the brain. Physical therapy and exercise improves mobility, flexibility and balance. Speech therapy helps with the communication difficulties. In severe cases, deep brain stimulation (DBS) or surgical treatment can reduce symptoms. Lifestyle changes such as regular exercise, healthy diet, and social support play a major role. Impact of life on because of Parkinson's disease doesn't just affect the body. It affects the mind and emotion as well as patients may struggle with independence, self-confidence and social interaction. Family support and community understanding are essential to help them live with dignity. Scientists are working on new treatment, including stem cell therapy, gene therapy, and neuroprotective drugs. With increasing awareness and medical advances, we are moving closer to better care and hopefully a cure. Parkinson's disease is not just a disorder of movement, it is a challenge that impacts the whole person and the family. By spreading awareness, supporting research, and showing compassion can make life easier for those living in Parkinson. Dr. James Parkinson once observed this disease may be slow in its progress, but our efforts to fight it must be strong, united, and continuous. So, Parkinson's disease is a progressive neurological disorder. It affects movement. Sometimes age is the biggest risk factor. It usually appears from the age of 60. Sometimes environment will also have an impact on Parkinson's disease. Long-term exposure of a toxin, pesticide or headache duration. Sometimes dopamine producing cells. Loss of dopamine producing cells. The condition develops gradually and worsens over time. Early diagnosis and proper treatment can improve quality of life. It is a disorder of movement. It is a challenge that impacts the person and their family. The whole family is affected in Parkinson's disease. A patient is also whole family is affected.